To be a quick one, we're going to talk about stimulus payments and the whether they're BS, clickbait, what's going on out there. After you watch this video, you will know 100% whether something is correct for many years going forward. If you're new to my channel, my name is Ed Weir, former manager of the Social Security Administration. I help people throughout the country make sure they're getting everything they're entitled to, from Social Security, retirement benefits, spouse benefits, survivor benefits, Medicare, Medicaid. So this is a live Q&A as well. So today's topic about stimulus payments, only going to take about 5 minutes. It's going to be quick, 5 or 10 minutes tops. And then I am going to open it up. So if you have any questions, make sure you type it into chat there, and I will answer any questions you have about all things Social Security, Medicare, and all the rest of it. If you're watching this on a recording later, make sure you subscribe, and that way you can find us in the future and keep updated on all things Social Security, Medicare, and everything. Okay, enough stalling. Let's get right into it. All right, so stimulus payments. Most of the stuff out there you see, and last month at Social Security, there was a social media thing going around there, and YouTube and TikTok and all over the place about $600 payments. And what happens is the social media people pick this up, and it really does a disservice, because what happens, it's obviously just clickbait and BS. And usually it's just some social media people trying to get you to click their website or whatever. And so Social Security actually had to put it on their website. There is no $600 payment, because what was happening is Social Security was inundated with calls and visits to the office and say, "Where's my $600? I heard there's $600. Where's my $600?" And again, I ran the third busiest Social Security office in the country, and I can attest that that is the fact. So for basically that entire week, this $600 BS was out there. Social Security offices throughout the country were all pretty much closed down, because they were just sitting there answering calls about $600. And all the people that needed help filing for disability and survivor benefits and spouse benefits and retirement benefits and where's my check and getting a new Social Security card and all that kind of stuff, they couldn't do what they needed to do. And Social Security is already understaffed, 27-year low understaffing. So that clickbait social media people that put that out there, congratulations, you got your views, but you've inconvenienced a lot of people looking for survivor benefits. Their spouse died, their parents died, and they couldn't get in because they were dealing with anyway. All right, you can tell I'm a little bit raw about that, because I dealt with it for many years at the Social Security Administration when that happened. Another way this happens is not only social media. One person says it and everybody else picks it up, but it's also low-level politicians, senators, House of Representatives, usually some House of Representative. And I am going to show you something which will address this. And let me get the image up here, and it's going to be a blast from the past. We're all familiar with this, right? How a bill becomes a law, schoolhouse rock, the conjunction junction and all that stuff. So how this happens is you get some low-level politicians somewhere in, East Texas. I'm from East Texas, so I can harass East Texas, West Virginia, wherever the case may be. And they're looking for votes. It's election season. They want to get votes. So what do? They say, "Hey, we're going to give you a stimulus package. If you vote for me, I'll give you $1,000. I'll give you free ice cream and unicorns for life, yada, yada, yada." And then you vote for them, and they completely forget about it. But during that time, someone picks it up, and some social media pick it up, and there's going to be this, that, and the other. No, it's just a bill, or not even a bill. It's some proposal. It's some, political campaign speech, just to get votes. It doesn't even make it to the bill stage, and it doesn't become a law, and it doesn't get signed by the president, all the rest of it. So to click on all this clickbait, a lot of these websites out there that, that look like official news websites, some of them are, produced overseas, and you click on it and you accept the cookies and, "Hey, stimulus package, $1,000. Did you get your stimulus package?" You click it, and then it might just be a malicious website. So here is how you can tell 100% for sure whether A stimulus is actually coming. Here's what you watch out for right here. Here is the trick. That's it. That is the way you know 100% for sure you're going to get money in your bank. Because any stimulus has to go through the House of Representatives, has to be passed by the Senate, and you know the president is going to get up in front of the flag, in front of the podium, and say, "I am such an awesome person. I'm going to give you an extra $600 or $1,000 or $2,000." So until you see this on TV, it'll be covered by all the major networks. Until you see this on TV, and that those words come out of that person's mouth that they just signed the bill that's going to get you money, don't believe it. Ignore it. Move on with your life. Don't stress. Don't click on clickbait and malicious websites. Don't, social media and all the rest of it. Just wait for that notification right there. Okay. That is my soapbox for today. Now let's get to the important stuff rather than all of the BS out there. And let's answer your questions on all things Social Security and all the rest of it. Let me get my chat up here. All right, Kimberly. Kimberly is asking about the Ticket to Work program during the 36 months after the 9 months. I understand you have to stay under it's SGA actually, of $1,550. Is that the only restriction? I heard you can only work 40 hours a month. So what she's talking about is when you're receiving SSDI, Social Security Disability Insurance, you are allowed to work to see if you're able to work. And the first 9 months is called a trial work period where you can work as much as you want to try to see if you can work. And then after that, you have the extended period of eligibility for 36 months. Every month you go over $1,550, you're not entitled to that month over the SGA. This year it's $1,550. Mostly it's the $1,550. What you probably heard is the 40 hours a month. That's for like self-employed. For any type of SGA, even working when you apply for disability initially, because I'm sure I was self-employed. Um, when you're self-employed, you can work 80 hours a week for years and not make any money. So that is another type of category. So if you're just working wages and stuff like that, and if you're working, just income, net income, even, selling stuff on, eBay or whatever the case may be, as long as you're staying under the $1,550 of net income for self-employment or regular wages, you are good. But Social Security, if you're working 80 hours a week and obviously you're just, putting the money back in the company to build it up, then Social Security can look at the actual hours you work to see if you are indeed disabled. Because again, Social Security defines disability as the inability to work. All right, Peggy, thank you so much, Dr. Ed. You have given me such a peace of mind. Yes, good, good. Knowing that you know and are willing to help us. I knew Medicare enrollment was coming up and I was perplexed. Perfect. Yes, good, good. Glad we were able to help. Yeah, this year Medicare is going to be crazy. If you've had a Medicare plan, a Medicare Advantage plan, particularly, 2025 is going to be the big year of lots and lots of changes. So make sure you review your plan. If you need help, call that number there and we can put you on the list. I put together a Medicare team that can help people throughout the country because I was tired of all the clickbait and people not doing the right thing. So old Marine Corps sergeant was like, if you want anything done right, do it yourself type stuff. So retiring July 2025, enrolling in Part B with CalPERS, Medicare reimburse. My AGI in 23 is 103,000. Part B will cost me 244. Can I submit SSA 44 or Part B sign up to lower it? Definitely sounds like you can. Farah, apologize for all the other people out there that didn't know what Farah was talking about. So CalPERS, so he or she, it's a snowman, looks like, worked under the state government of California and did not pay into Social Security. So you are going to be charged the extra IRMA premium. Everybody pays the $174.70, but high wage earners pay extra. And that's what he or she is talking about. Let me pop up for everybody else. I think I have the IRMA rates for this year. So this is what the IRMA rate. So if making over 103,000, between 103,000 129,000, you have to pay $244. Anything over $500,000, you pay $594 per month for the Part B premium. And so yeah, that was passed a few years ago to try to shore up, Medicare. High wage earners pay more into the Medicare premium. But Faro, yes. So an SSA 44 is the form that you use to report a life-changing event. So you made over $103,000 2 years ago, and that's what they base the IRMA on, is income from 2 years ago. But if you have since stopped, which you will stop next year, yeah, once you stop, then you put in that SSA 44 and say, yeah, I made $1 billion 2 years ago, but I stopped work last month, last year, since then. So they will readjust your IRMA back to the $174. And since CalPERS is paying for that, that's a beautiful thing. Hello, with the stimulus, there is no stimulus. Include checks for under 65 who are on Social Security. Is there a limit to how much a 76-year-old can make on Social Security? Yeah, again, there's no stimuluses. Nobody's talking about a stimulus. Yeah, so there's always people talking about a stimulus, but usually it's BS until you see the president up there. I just signed this, that, and the other. So we'll see. That's what we used to tell people when they came into Social Security Administration. It's just like, I wouldn't trust it until it's in your bank account, because politics, always something happens. So I know it's in the U.S. Constitution that you should spend money before you get it, but I would recommend waiting for it to actually hit your. I wouldn't trust it until it actually hits your bank. So there's that. I am 58 years old on SSDI since 55. I was married to my late vet husband for 14 years. I remarried and divorced. Do I get VA medical benefits? Yeah, I can't help you with VA. I never worked at the VA, even though I'm an old Marine Corps sergeant. I know a tad bit about, but yeah, I would reach out to the VA. But in terms of Social Security, I can definitely help you with that. You're 58 years old now. So when you hit 60, if that, I don't know if your ex-husband is alive or deceased or whatever, but if your ex-husband is deceased, you could very well collect surviving spouse benefits in a couple of years at 60. If your ex-spouse is still alive and kicking, then you can collect divorced spouse benefits at 62. If the numbers work, in terms of if there's more money there, you can collect up to 50% of that person's benefit if they're alive, up to 100% if they're deceased. Melinda. Oh, Melinda, I see you scheduled an appointment. Melinda's with Autism Oklahoma, and I apologize for not getting you back. I've got hundreds of emails I have to go through, so my son helps me. So, planning to quit my salary job and begin receiving Social Security. However, I'd like to earn income through my LLC as a contractor. Is the annual earnings limit calculated on gross income or income less expenses? From net income. It is net income. So I think you're scheduled an appointment, Melinda. You've got a bunch of other questions. So we will get to the other questions when we talk to you. Can you collect unemployment and Social Security at the same time? Yes. So unemployment was actually part of the original Social Security Act of 1935. So it's not only Social Security. My unemployment benefits end October and my Social Security starts October. Will this be a problem? Nope, not at all. So you can even start your Social Security benefits early. It has no relevance to unemployment benefits at all. Let me see. Politician said he would bring SSI recipients up to the poverty level and increase assets to 10,000, which is today's equivalent of 2,000 in 1989. Yeah, there is a in the policy planks for each party that the Biden Harris, I guess now the Harris one, has that in there to increase benefits up to the poverty level for people on retirement and disability and all the rest of it. So definitely check those out. I'm just a bill, only a bill sitting on Capitol Hill. I like it. Can you repost your question? Oh, Lenore, let's see. A widow friend, there we go. I always like people looking out for their friends. Collects benefits for a few months out of the year. Then her wages exceeded the check stop. She office said, no, I couldn't do that. So yeah, if you work over the annual earnings limit, again, this is early retirement. So she's 62, 63, 64, 65, whatever. What happens is if you make $10,000, so this year, $22,320. If you make 10,000 over the annual earnings limit, then Social Security will hold back $5,000, $1 for every $2 you go over. So if your benefit amount, let's make it easy, is $1,000, they're going to hold back the first 5 months, and then they release the remainder of the year. So that's probably what's happening to her. And they do it based on kind of last year. So if that's what it was last year and it all looks good, then continue going on. But if she, stops working or increases working or something like that, make sure she calls Social Security and do a work report. And that way, if she stops working or reduces her earnings, then, they might release more checks. Take and took, always looking out. Please remember to like the video so the algorithm can notice it. Yes, more people need to get this information. My husband is already retired and I will be put on full retirement age at 66 in 10 months. Should I wait until then to get spousal? So yeah, it really depends on yours. I will be full retirement age at 66 in 10 months. Should I wait until it gets spousal? So yeah, if you're you already filed on yours, then yeah, you definitely need to file on his. If he's already receiving benefits, I assume it's your current husband, unless you're working or something like that. But yeah, again, it depends on the calculations. When you should start benefits, whether you're working, whether you need the extra money, your health, tax considerations. The extra money, is that going to put you in a higher tax bracket? A lot of different variables. So I would call up Social Security and say, hey, if I start collecting benefits now, how much am I going to get? If I wait until my full retirement age, and then you calculate, it says, okay, it's going to be $50 more a month, but I'll get $10,000 of checks ahead of the game. So definitely, yeah. The Social Security office told me I could not collect widow's benefits that way. I would be stuck with a $600 a month forever and not be able to collect my $1,500 one time. Not sure. Let's see. Trying to dissect this. I could not collect widow's benefits that way. I would be stuck with 600. No, if you collect widow's benefits, you haven't touched your own record. You can collect survivor benefits starting at 60 and don't touch your record. And then you let your you let your benefit amount increase until 67 or whatever your full retirement age. Even after that, all the way up to 70, you get those delayed retirement credits. Yeah, but if your survivor benefits is only 600, it really depends. Some people say, well, yeah, it's only 600. I don't really need the money right now. I'll go ahead and get it started. And then when I jump onto my own record at 70, then, it'll be a lot more. So, yeah, you need to really make that decision. And Social Security, yeah, they're not really supposed to provide that kind of financial advice like that. They're just supposed to tell you, hey, if you get survivor benefits now, it's going to be $600. If you get your benefit to your full retirement age, it'll be $1,500. If you wait, it'll be a 24% above that. And then they just shut up. That's what they're supposed to do. Not supposed to say, you should really do this. You should really do that now. So only 23 out of 148 say like, yes, please. Could hubby apply for SSDI, born 58, collecting Social Security for 3 years, worked at a warehouse, had to quit suddenly for major surgery. Yeah, if for a spinal cord, not at FRA yet. Yeah, if anybody is under full retirement age, they can definitely apply for Social Security disability benefits. Unfortunately, it's taking 6 to 9 months to get an approval to get a decision. But Yeah, doesn't hurt to try. And if they're approved, it won't affect their Medicare because they're already sounds what Medicare eligible. Um, so they won't get their Medicare any early, but it just might increase their benefit amount. Um, so yeah, I would definitely check that out. But yes, you can apply anytime before your full retirement age. After your full retirement age, then Social Security disability is automatically switched to retirement benefits. So nobody gets disability after their full retirement age. Dr. Ed, I have dual eligibility. I also work sometimes as a freelancer. What if some month I earned a little over the income allowance? Will it kick me out of Medicaid? Yeah, it really depends on your particular state. Medicaid is a state health insurance, low income, low resource, welfare type of means tested health insurance system. So it depends I guess, how militant your particular state is. But sometimes they give you kind of a little break and, they might, whatever, or they might average it over the year. So like if you're a freelancer, and I know Social Security does this on disability. So if you have work that, gig work or whatever that kind of goes up and down, one month you make, some money and another month you don't. And then Social Security can use a yearly averaging. You always kind of have to ask for that because a lot of Social Security employees don't know you can actually do that. But Medicaid, they might be able to do that too, depending on your particular state. So, and remember, if you have a dual eligibility, make sure you check your Medicare plan coming up. There's going to be a lot of changes with the dual eligibility. Dual eligibility for everybody out there is that as their trend has Medicare and Medicaid. And because he or she has both, she's eligible for a Medicare Advantage dual eligible plan. And unfortunately, they're kicking a lot of people off of Medicaid, some correctly because they no longer, are low income, but sometimes they're making the wrong decision. Medicaid is. Can you tell me about the rule for taking SSI early for a year and then stop SSI? And yeah, SSI, yeah. Yeah, you don't mean SSI, you mean Social Security. SSI is the welfare-based program. You mean just regular Social Security. Okay. So stopping Social Security and paying back all the payments for that year, then take Social Security at your actual retirement age, you get Social Security without a penalty. Yep, it's just a withdrawal. So within 12 months of filing a Social Security retirement claim, then retirement being, survivor, spouse benefits, everything. So if you get those benefits for a year, and within that 12-month period, you say, oops, I shouldn't have done that, then you can withdraw the claim. So you withdraw the claim like it never happened. And because the claim never happened, you should have never received those benefits. So you have to pay back all those benefits. And it's like nothing ever happened. So then, later for retirement age, there's no penalty, there's no reduction because it never happened. Never happened. Joe, Dr. Ed, I contacted my senator and got my back pay. Yes, there we go. That's how you do it. Sometimes if your local Social Security office is just not doing the right thing and you try and try and try, then sometimes it's just better just go ahead, reach out to your federal politician. So I think that's what Joe did and got the money. Awesome. Lenora, 65, retired mail carrier here. I wanted to get Medicare Part B during this special enrollment period to avoid penalty and keep our FEHB for supplement. Broken key. Well, yeah, I haven't really looked too much into. I know. So postal workers are the postal system is a completely different entity from all other federal government workers. OPM, Office of Personnel Management. The postal this year is requiring people to sign up for Medicare Part A and Part B. Other federal employees that have federal employee health benefits don't have to sign up for Part A and Part B if they don't want to, but postal workers are unique. So I would reach out to the postal and see how the new thing is written. So yeah, I'm gonna have to do a little bit more research on the new postal thing, but yeah, they're always strange. In a good way sometimes. Yeah. So If I made 38,000 between my survivor SSI, Social Security, again, SSI is the welfare-based benefit. If you're receiving $38,000, you're definitely not receiving SSI. And my pension that I get, which they take taxes out of, how much more am I allowed to make? Okay, $22,320. I did the quick math there because your survivor benefits don't count. That is not earned income. And your pension doesn't count because that's not earned income. So, according to what you just wrote, you have another $22,320 a year you can make. So, there's that. Let's see. My first Medicare payment was over $800, and the next one was a little over 500. Does that make sense? Sounds like you are under IRMA. Or if not, then you are not receiving Social Security benefits. You just signed up for Medicare, so you're being charged quarterly, and the first quarter that you're paying for has an extra month added on there. So that's probably why it's 800 and then 500. So if you didn't make over 100,000 or so 2 years ago, and if you did not make over $100,000 2 years ago, then that is just basically a 3-month quarterly bill. So Cheryl, I confused me. If one is receiving widow's benefits beyond their full retirement age, will the annual 8% be paid up to not quite? No, not on widow's benefits. The delayed retirement credits will only get on your own. So it affects, survivor benefits. It's because you're receiving benefits. So you're not delaying, and it's not on your work record. So if you do not receive Social Security benefits until you're 70 years old, then you'll get the extra 24%, 8% per year added on. And what a lot of people don't know is you can actually suspend your benefits when you hit your full retirement age. When you hit your full retirement age, you can call Social Security and say, I want to suspend my benefits because I want that 8% increase. And I will call you later, sometime between now and when I turn 70 years old, and restart my benefits. But the problem is when you call Social Security, most employees don't know about that. So I just put the reference down. It's called voluntary delayed retirement credits. So it's only on your own record. So if you're receiving benefits on your own record and you want a 24% bump, you call up Social Security a couple of months before you turn your full retirement age and say, stop, cease and desist. I will recontact you at 70 and I'll get that extra 24%. Sunshine, hello. If I work and earn more than 22,000 limited earning while receiving spousal, child, and care, my benefit will be reduced. Will those money be recalculated and paid back in the future? So if you earn more, yes, your benefits will be reduced. $1 for every $2 you go over. And no, they will not be recalculated because the only way your benefits are recalculated is if you're receiving benefits on your own record and then you don't get a check because you went over the annual earnings limit. Then basically what happens is then once you hit your full retirement age, they adjust the reduction. So, but in your case, no. Kim, hello. I'm retired. Will be 65 early next year. I have FEHB, which Federal Employees Health Benefits, but think that a Medigap supplement plan in conjunction with Medicare would be better. What do you think? I disagree. That's just too much. Yeah, I if you want to go for it, but I wouldn't. So that's just, you're already paying for Federal Employees Health Benefits, and those are pretty good depending on which one you pick. So I wouldn't. Just, waste of money. I've been on SSDI for 20 months and it's supposed to roll over automatically to Medicare. How will this affect the bills being paid for Medicare currently? I'm currently on a new CPAP. Yeah, so you've been on, once you're on Social Security disability for 24 months, You will get your Medicare card in the mail automatically. And so yeah, it won't affect Medicaid. Actually, you'll have more opportunities. So you'll have you'll be dual eligible. It depends on what level of Medicaid you have. There are different levels of Medicaid depending on the state and your income and all that kind of different stuff. But if you have like a QMB, qualified Medicare beneficiary, or QI, or a SLIMB category, then um, they will pay for your Part B premium, the $174.70. And if you have Medicare and Medicaid, you might be eligible for a Medicare Advantage dual eligible plan. I usually recommend avoiding Medicare Advantage, but I like Medicare supplements. But if your budget doesn't allow a premium for the supplement, then it is what it is. You get a Medicare Advantage. But if have Medicare and Medicaid, then yes, Medicare Advantage dual eligible all day long. Those are the ones with all the, depending on your area, the flex cards and grocery cards, and help with, maybe, over the counter type stuff. It really depends on your area. So in a couple of months, you'll receive your Medicare card in the mail. So if you need help, call that number right there, and my Medicare team will help you out. Press 1, and you can talk to my Medicare team, and they can help you out. Can you find out what ex-spousal Social Security retirement benefits are? If yes, do you only need to bring your own ID to the Social Security office? What about current spouse with asking? All right, so ex-spouse. So yeah, if you're currently married, then yeah, you can't get it anyway, unless your ex-spouse is deceased and you were remarried after 60. But to answer your question for everybody else out there, that yeah, if you want to find out if you're entitled to survivor benefits, if there's any extra money on a deceased ex-husband or spouse, or if you want to find out if there's any extra money on a divorced spouse that you were married to for 10 years or longer, then you just call the 800 number, and you tell them, if you don't know the Social Security number, you just tell them the person's name, their date of birth as well as where they were born, and Social Security employees can find it out. I've done it millions of times. They won't give it to you. Somebody yelled at me, they didn't give it to me. Well, yeah, they're not going to give it to you. They'll be able to find it. But they usually don't give you that number, especially if the person is still out there alive and kicking. So, but they will get benefits. In the old days, they've said, yeah, we're not going to tell you what that person's Social Security number is. But then when they sent out the letter, it had that person's Social Security number on it. So it was always crazy. But now they switched it to the BNC number. You notice in your Social Security letters that you get, it's got a unique beneficiary notice code, a unique number, which was awesome. It's a good thing they did that. Protect your information. Social Security is really, really good about protecting your information. So not unlike these other companies out there that send out 2.9 billion people's records. So knock on wood, Social Security has been doing an awesome job protecting your information up until now. So is pension considered an income? It really depends on what category we're talking about, taxes and stuff like that, obviously. But now, if you're talking about early retirement, no. If you're talking about you're getting disability, no. If you're talking about you're receiving SSI, supplemental security income, yes, because that's a welfare benefit, and therefore that's income coming in. So it really depends. I don't believe it. So yeah, Mama D, I don't. Penelope is always awesome. I don't believe the Social Security office is going to tell you what your benefits, ex-spouse's benefits are. Yeah, they will tell you whether you're entitled to benefits. So let's say you're not married right now. They will say, yes, there's more money there, but they won't tell you technically how much, until you go down there and provide proof, marriage certificate, divorce decree, sign up for the benefits, and then they kind of won't. They'll tell you what that person's primary insurance amount is, their benefit at their full retirement age, but they won't tell you how much the person is actually receiving. Maybe the person filed for benefits early, or maybe they waited till they're 70 years old. That doesn't matter, unless you're filing for survivor benefits. But anyway, normally, yeah, they don't. But then you can kind of put 2 and 2 together and you figure it out. I'm 63 and have been on SSDI since 2019 due to a spinal cord injury. Wow. Should I just apply for my retirement? And what do you think? Yeah, no, I would not, because you're going to lose money. So you're going to cut your check by what, 25% if you file for retirement benefits? Nope. You're going to stay on Social Security disability insurance until you hit your full retirement age. And once you hit your full retirement age, then you will be switched automatically from disability to retirement benefits. Check stays the same, direct deposit stays the same, and all that kind of good stuff. So, but now that you're 63, there's a couple things you need to do. Once you hit 60, if you're on Social Security disability benefits, check to see if you're entitled to any survivor benefits from any deceased spouses. Once you're 62, are you entitled to any spouse benefits, divorce spouse benefits, independently entitled divorce spouse benefits? Once you hit 65, check to see if a Medicare supplement plan is better for you rather than a Medicare Advantage plan. So those are 3 times that you need to check it out a little bit. Beer Weir, how are you? I work for Social Security as a BA currently in the PC. Any advice to a young buck trying to climb up the ranks to become a manager someday? Beer Weir. I was known in the Marine Corps as one Beer Weir. I'm just such a lightweight. I'm a cheap date. Yeah. How I became, I was hired as an outstanding scholar under a program they don't have anymore. And I just worked my butt off and volunteered. Anytime anything in the office happened, hey, we've got this bunch of overpayments we need to deal with it. I raised my hand. Hey, I took more claims than anybody else. And so, yeah, just, the old Marine Corps gung ho. And I worked my way up pretty quickly. Yeah, it's tough. 27-year low in terms of staffing. It looks like if the budget, if they don't do something with the budget, it looks like it's going to be a 50-year low. And people don't understand that, anytime that happens, Social Security, that's their job. Your job is to make sure the American people have the right check at the right time, right? And that's your job. But unfortunately, that so understaffed, you probably got thousands of stuff that, PCACs and MDWs and all the rest of it. You know the deal. A101s, EF101s, and all the rest of it. So, yeah, just keep at it. So, if I keep working after 66 old and collecting, again, not SSI, you're probably talking about regular Social Security, will my benefit keep going up every year that I work? Possibly, yes. If you work and you pay into FICA, yes. People say, hey, I started collecting my Social Security benefits. Why do I still have to pay FICA? Yeah, unfortunately, you have to pay Social Security and Medicare forever. But Robert, yes, if you are receiving benefits, retirement benefits, and you continue to work at 66, 76, 86, and you pay into Social Security, then every year when you file your taxes, the IRS will notify Social Security of how much you paid into Social Security and all that kind of good stuff. And Social Security will look at it and say, hey, is this one of Robert's high 35 years? And if it's one of your high 35 years, they kick out the low one, stick in the new one, recalculate, and your benefits get increased. Yep. Only if it's one of the high 35 years. Dr. Ed, if I move to another country, can I suspend paying my Part A and B? A is for free for most people, unless you didn't get the 10 years. But yes, but with the understanding that when you come back and sign up for B, you're going to be penalized 10% for every 12 months you did not have Part B. And you can only sign up during the general enrollment period, January, February, March. So yes, you can, but you're going to be penalized, unfortunately, when you come back, because Medicare is insurance just like any other insurance. It's people say, I'm not using it. Why do same thing with Part D. A lot of people, this is the same situation with Part D. If you stop your Part D, your prescription drug, you're going to be penalized 1% for every month you do not have it. And people say, well, I don't take drugs. Why do I need it? Because it's insurance. I'm not going to have a car accident today. Why do I need it? And health insurance it's people pay into the premiums every month for the people that are actually sick and in the hospital and doing operations and all that stuff. And then eventually, hopefully never happens to you, but when you do need it, then that's, it's a pooled risk. So just like every other insurance. What is the information on being contacted by insurance companies? Starting to get calls again. Oh my gosh. Yeah, it's That's the whole stimulus clickbait stuff. That's part of it too. Is when you click that stuff, the stimulus, that website knows you're maybe receiving Social Security benefits, so they sell that information to a giant, the data broker, like the one that just lost the 2.9 billion. They probably sold your information, and that's how Medicare people throughout the country get your information, and they start harassing you. And yeah, it's a nightmare. The Center for Medicare and Medicaid Services, Medicare, changed the law or changed the regulation recently, and they said if a Medicare insurance agent or broker puts an ad on Facebook and says, "Here, click this button, and we can talk about yada yada yada," then Medicare, up until recently, then that person will call you up and try to sell you. And if they couldn't sell you, then they sold your information to everybody for $1 or $2 and stuff like that. Everybody and their mother used to call you and harass you. Medicare said, no, 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 you can't do that anymore. You can't do stuff like that. It's a one for one type thing. If you click the button that says, "Hey, John from Omaha, I want you to contact me," then John from Omaha can contact you, and that's it. And there was the health insurance companies complained about that. They went to a Texas judge because of the new Supreme Court ruling, and the Texas judge actually said, no, that's okay, but they're going to try again. So yeah, it's unfortunate. So again, if you need help, then we can help you out. And then if anybody ever calls you again in the future, and call up and say, "Is this Dr. Ed's guys?" And if they say no, you just hang up. I have FEHB, and when I retire, is it best to sign up for Part B also? Yeah, again, it's really your decision. The federal employees' health benefits, they don't demand, like, unless you're the post office. If you're the post office, you have to sign up for Part A and Part B, but every other agency, you don't have to. Some people do, some people don't. So, why don't you like Medicare Advantage? Also, can I switch from Medicare Advantage back to Medicare? It's it's the pre-authorizations, the networks that are always changing, and if for sure you're looking in your crystal ball and you're never going to be really sick, if oh, for the next 50 years I'm just going to go get checkups and stuff like that, then yes, Medicare Advantage all day long. Yes, absolutely, 100% Medicare Advantage, zero premium. And you might have to pay a little bit of $10 here, $20 there, and stuff like that. So yes, if you're never going to be seriously sick, Medicare Advantage, save yourself the money. However, life is what happens while we're making other plans, right? Medicare supplements, there is a monthly premium depending on where you're at in the country, anywhere from 80 to 100, 120, New York, a couple 300. So there's no pre-authorizations and no networks. So if you actually get sick, you'll probably say, "I should have got a Medicare supplement plan." But if you don't get sick, you'll say, "Oh yeah, I wasted all that money, all those years on that Medicare supplement plan." So it's unfortunately, and that's what insurance is. It's, you just kind of throw the dice, and yeah, it's like, I wish I had all the money back I paid into car insurance over the last 40 years. I'd be able to buy me a few Ferraris. But yes, in terms of, yes, you can go from Medicare Advantage back to Medicare. You can only do that at certain times. Most of the times it's during the annual enrollment period that's coming up here in October. If you're not 65, or you didn't recently sign up for Part B, then you might just have to go through health underwriting. So if you're healthy and you want to get out of the networks and the prior authorizations and all that other stuff, then you should really consider switching to a Medicare supplement, either a Plan N or a Plan G. I've done a couple of videos on the differences between the two. So, and if you want help with your Medicare plan in October, call that number and they can put you on the list for when the new plans come out in October 1st. If I take dollars from 401k, will they deduct from my check? No. Need to pay bills. I am 65. My full goes in effect 66 and 8 months. No, if unless you're receiving SSI, which is the welfare-based benefit, which I assume you're not because you have a 401k, and so that would have made you ineligible for SSI. But no, if you're just receiving retirement benefits, spouse benefits, survivor benefits, 401k make no relevance whatsoever. Take out as much as you want. Isn't FEHB basically an advantage plan? No. I mean, yeah, they still have networks and yes, so there's that. So how do you know which amount is more before you determine whose retirement benefits to claim on if you're not given the monthly amount? I'm confused. Yeah, yeah. So if your ex is still alive and kicking, you have to file for benefits on your own record first. Okay. So you file for your benefits on your own record, and then you call Social Security and say, "Hey, I want to file for benefits on my divorced spouse record." And they will look at your PIA, your primary insurance amount, which is your benefit at your full retirement age. They will look at that person's PIA and they will say yes or no. And if they say yes, that means there's more money there and they will schedule an appointment. If there's no more money there, then they will say, yeah, there's no more money there. If it's a surviving claim, same type of set, you just call Social Security and they will tell you whether, you know, there's more money there, but that goes up to 100%. So some people, there's a lot of people out there that are missing money that do that when their ex-spouse, their divorced spouse is alive, and they call Social Security and they say, "Is there any more money for me there?" And Social Security says, "No, there's no more money there for you." Because if your ex is still living, you can only get up to 50%. But what the Social Security employee should do is say, no, there's no more money there today because you can only get up to 50% minus your own. And that person's still living. However, if something happens to that person, you can get up to 100%. So you might be eligible for something in the future. And they should tell you that because there's a lot of people out there that are, struggling and they're saying, no, I called Social Security a few years ago and there's no more money there. And you're like, wait a second, that neighbor down the street says, didn't your ex just pass last year? Yeah. You need to call again to see if there's any money. So please, let's look out for each other. So that's how you find out. My son with autism is 21 and we are applying for SSI for the first time. Is he able account and 520 included in his income? Able account is not. I'm not sure about the college saving ones, but the able account is not, depending on how much is in there. Well, how much you've contributed and stuff like that. I did a video on able account a couple 3 weeks ago. So check out the able account. And there's also the website. The website is super, super easy to figure out. It sounds like you probably already have an able account. So yeah, able accounts don't affect SSI or Medicaid eligibility. So they just passed that law a few years ago. I think it's a great law. Stephen, I have heard that in 2025 that if don't get in, we would only get 40% of our Social Security benefits. Yeah, it's I don't know about that. Anyway, sounds like more, but we need to do something. And 2034, 2035, there's going to be a benefit cut of 17% because the trust fund is going to be empty. And that was the intent of the trust fund. The trust fund was savings for future baby boomers. They missed the calculations a little bit. They didn't realize the rich were going to get so rich and therefore not pay FICA taxes. So there's that. Let's see here. Joe, I am on SSDI and want to take some money out of. Oh, okay, I already answered that one. Thank you, Weir. You're welcome. Okay. Why did they take $250 out of my Social Security check? They said they'll hold it for me. I can get it back from. Yeah, I have no idea. Not sure. I'd reach out to them and say, hey, what's going on? Do you think they will get rid of spousal? No. Yeah. Part of the Republican study committee proposal is they were going to means test spouse benefits. That means if you're, making X amount of money, you don't get spousal benefits, but I don't think that's going to pass. Do I have to sign up for Medicare Part B if I have an insurance for life through my deceased husband? You don't have to do anything in life, but If you decide to sign up for Part B later, then you're going to be penalized 10% for every 12 months you did not have Part B. But if you know for sure you're going to have insurance from whatever retire pension plan or whatever your husband had, and you're happy with it and it's good, it's not too expensive, you know it's going to be there forever, then yeah. But if you something happens in the future and you want to sign up for Part B, you have to understand that you're going to be penalized 10% for every 12 months period, and that penalty lasts forever. If I have prior health conditions, being on disability, am I able to get these health supplement plans? The Medicare supplement plan, the Medigap plan, it really depends on your state. That's why New York is like so expensive, is because they do it right. If every state did it like New York, then it would be a lot better. But it really depends on your particular state, whether your state politicians demand that these companies offer you plans, and they control how much extra they can do. But most people on disability under 65, unfortunately, in their state, they can only get a Medicare Advantage plan because their state doesn't offer Medicare supplement plans, or they're just crazy expensive. But once you reach 65 years old, then you can do whatever you want, and you no issues with prior conditions or extra charges or anything. So, is there anything that covers dementia or else? Um, Alzheimer's, dementia. Other than, yeah, no, not for Social Security. It's just regular disability benefits. Yeah, so I would definitely reach out to, not sure, extra money, or um, definitely, Medicaid to help you with, medical health issues. Deb, if the Social Security schedules you an appointment, then you know there's money for you to collect. Exactly. That is the trick, because Social Security is not going to schedule you an appointment unless there's money there for you. Unless you demand for an appointment. If you demand, I don't care if there's money, I want an official decision, because sometimes people need the actual paper for some other reason. So we used to have people come down all the time. I've taken so many claims from pregnant people, females, and disability. They want to file for disability, but in order to get disability from Social Security, your disability has to last a year or longer. And every state, I don't think pregnancy, maybe Florida is different, but anyway, yeah, there's no states where pregnancies last 12 months or longer, but didn't matter. If the people demanded, they didn't believe me, that had to be, that was the regulation, then I had to sit there and go through the entire application process, and then push the button, and it was denied, but they received an official letter that it was denied because their disability wouldn't last over 12 months. So, and that's where, part of that whole, other internet myth that everybody's denied the first time on disability, which is 100% a myth, and people need to stop repeating it, because it does a disservice to people that need disability benefits, and they're already kind of down and depressed because they're not able to work, and then they hear that, and that makes them feel worse. So stop repeating stuff that's not correct. Second part of the question: my husband will retire in 66 in 10 months. Should I still wait until turn retirement since I'm SS? If no, if you're on SSDI 63, um, and as soon as your current husband, starts receiving benefits, then your husband files at the office or on the phone or whatever the case may be, and as soon as he finishes his phone call filing the application, have him hand the phone to you, and then you say, "Hey, any more money now?" And then they will see if your benefit amount is less than half of his, and see if there's any money. And if there's any more money there, then they will get you that money. I was ready to give up after 4 judges. One administrator told me, if you keep trying, most likely you'll get through. It's the people who quit who get nothing. Yeah, just keep on keeping on. You've got it multiple stages. You got the initial for disability. Joe's talking about disability benefits. You file for disability benefit, the initial, then you file reconsideration, then you go to the administrative law judge. That doesn't work. Then you go to the appeals council in Falls Church. You don't have to go there, obviously. It's anyway, and then you can file a suit in federal district court, and then go all the way to the Supreme Court. Can I apply for SSI aged and retirement benefits at the same time? I still need a year and 10 months for retirement. What's my best choice? No income right now from work, unemployed. Yes, so SSI aged. So SSI is the welfare benefit, again, supplemental security income, and you can get it based on two categories. SSI is for those that are disabled, that don't have, it's again, welfare, limited income, limited resources, no, your benefits from a regular disability is not more than $943. But if you apply for SSI, um, and you're just waiting around for your retirement benefits, you can't do that. You have to apply for your retirement benefits first. And if it's less than $943, then they will also take a claim for SSI aged at the same time to bring you up to $943. Roy, if I get married and pass first, can surviving spouse benefits be attached through judgments or Lowe's benefits exempted in any way? No. Yeah. Adding any type of stuff like that through a divorce decree is not relevant. Um, if that person was married to you for at least 9 months, and they were married to you when you passed, and they were married for 9 months, they're entitled to benefits on your record. If they were married to you for 10 years, um, then they're entitled to benefits on your record. So there is no, you know, in the divorce decree or judgments or anything like that. It's not relevant. I filed for survivor benefits last month. I'm 60, plan to work till 65. I went on the website and saw that my benefits are suspended due to the working, even though I was told it would be reduced. Yeah, they don't reduce them, they suspend them. So reduce for the entire year, but yeah, so they hold back however many checks. So again, if you're make $10,000 over, that they're going to hold back $1 for every $2 you go over. So they're going to hold back $5,000. If you make $5,000, or if you make $1,000 a month, that means they're going to hold back the first 5 months, and then they will release the check starting in June. And they can't hold back partial months. So if your check, if you know is if you make $50 more for the fifth check, they will hold back the entire month of check. They can't hold back partial Social Security checks. So they withhold the entire month if you go over. All right. If I take Social Security at 62 and then suspend it at FRA, will it grow by 8% till I reach 70 and resume payments? Yes. Yep. Absolutely. So we're talking about on your own record. Yeah, and you have to manually go in there at 70, a couple months before 70, or any time, because Social Security doesn't know when you want to restart it. So if you want to restart it at 68, 69, or wait till you're 70, make sure you go in there a couple of months before 70 and get them restarted. And make sure if you do that, make sure you take that reference down there, because if you just walk into a Social Security office and tell them that you want to do that, then they'll look at you like you have it, like you're an alien, because they don't know. So I wish they would do more training on that, but not many people do that strategy. So Ed would like to get a supplement plan. Unfortunately, I just can't fit it into my budget. Yeah, that's the unfortunate part. But I will try Advantage for a year and just see how it goes. There you go. All right. Yeah, that's why over 50% people choose a Medicare supplement plan. Is it's zero premium. But again, it's a pay as you go. With a supplement plan like a G, if you have $1 million, cancer treatment, you pay $240 and you're done. And obviously you pay the monthly premiums. But if you have a Medicare Advantage plan, then they $500 for a hospital, and $100 for this, and $50 for that, and yada 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 yada. There are maxes, max out of pocket, uh, relevant to what plan you pick. My doctor said I'm legally blind. Do I qualify for SSDI? And if so, do I need an attorney to apply? You don't need an attorney. You can get one if you want, but the initial application process is, relatively easy. And, if you get an attorney, they're going to ask you the same exact questions that are on the application. So watch my videos. I did 3 videos on applying for disability, all the tips, tricks, and secrets. But yeah, if you're unable to work because of your disability, absolutely file. All right. I still don't understand how will it be empty? Only do I yeah. So illegal immigrants do not receive Social Security benefits. So that is another internet myth. Um, how now I understand. Thanks. So keep track of ex-spouse or cuz receipts. Yes, exactly. So surviving spouse up to 100%, living spouses up to 50%. My husband died this year, and sorry to hear that. And Social Security told me that I qualify for widow's benefits. His benefit is 2280 a month after deduction. How much should I get from his benefit? It really depends on your particular age. Yeah, survivor benefits are difficult to calculate because it depends on if you're your full retirement age. Then you could get up to 100%. It depends on when he filed, whether he was receiving disability benefits, all the rest of it. So I would call him up. But yeah, his benefit was 2280. So if you're your full retirement age, you'll probably get 2280. With all these clickbait advertising for stimulus payments, and then we don't receive them, how do we tell if someone stole them or not? Stole them? Oh, that the actual. Yeah, again, just watch for, if I don't know if you came in late, but watch for this telltale sign that there's an actual stimulus on the way. And the telltale sign is a president going up there saying the money is on the way. So if you don't see that, then it's all BS. Will my retirement Social Security be different than my current SSDI? Nope, it'll be the same amount. So once you hit your full retirement age, your disability benefits will switch to just regular old retirement benefits, and the check amount stays the same. Medicare stays the same, but now you're free. You don't have to worry about trial work periods and work limitations and all that other kind of stuff. You can do whatever you want. No more continuing disability reviews, all the rest of it. So all right. We are over an hour. Let me see if I see anybody that I've never seen before that has a questions. I don't think I've seen Steven Sims before. Let's see. I'm presently on Social Security disability. I'm having trouble understanding how I can work some without affecting my payment amount. Does every $1 I make deduct it from my SSDI? Or how much can I make? Okay, no, that's the one for two type thing, that's more SSI, the supplemental security income. If you're just receiving regular Social Security disability benefits, then you can make up to, for the first 9 months, you can make, all the money you want. But watch my video I just did a video. Do I have a picture of it? I don't think I have a picture of the video. I just did a video a couple, 3 weeks ago on Social Security disability and working. So make sure, okay, there it is right here. So if you're receiving Social Security disability insurance, then watch the video at the top. If you're receiving SSI, watch the video on the bottom, and it'll give you all the details on working. So you just go to my YouTube page, and it's under the live. I did these live. So it says it's an hour, just like all my videos are an hour, because I do a Q&A afterwards. All right, that is it for today. Thank you all. Make sure you take care of each other. And I'm sorry I couldn't get your question. If I didn't get your question today, make sure you join tomorrow or the next day or next day, and be the first one in.